What if the next deadly virus is already on the world's radar, but not in America yet? You've heard of COVID, you've heard of Ebola, but have you heard of Nipah virus? Some call it more deadly than COVID. Others say it's the next big pandemic risk. So here's the real question. Is Nipah virus coming to the USA? And if it does, will you be ready? Stay with me, because what you're about to learn could matter more than you think. Today, we're diving deep into Nipah virus. What exactly is it? How dangerous is it really? What are the early symptoms you need to know? Can it spread from human to human? And most importantly, what should Americans do to stay safe? We're going to break it down simply, clearly, and honestly, without the hype and fear-mongering you see elsewhere. Let's get into the facts first. What is Nipah virus? Nipah is a rare, but extremely dangerous virus. It belongs to a family of viruses that can cause severe illness in both animals and humans. It's what scientists call a zoonotic virus, which is a fancy way of saying it spreads from animals to humans. The main natural carriers of this virus are fruit bats, which are also known as flying foxes. These bats can carry the virus without getting sick themselves, but they can pass it on to other animals, like pigs, and then from those animals to people. The virus was first identified back in 1999 during an outbreak in Malaysia and Singapore among pig farmers. Since then, outbreaks have mostly been concentrated in South and Southeast Asia, particularly in countries like Bangladesh and India. What makes Nipah so scary isn't necessarily how fast it spreads, but how deadly it can be for those who get infected. So, just how deadly is it? This is where the numbers get really serious. According to the World Health Organization and the CDC, Nipah virus has a fatality rate that can range anywhere from 40% to a staggering 75%. To put that into perspective, that means in some outbreaks, nearly half or even more of the people who get infected may not survive. This high fatality rate is a major reason why global health organizations are on high alert whenever an outbreak occurs. Adding to the concern is the fact that there is currently no approved vaccine to prevent Nipah, and there is no specific cure or drug to treat it. Treatment for someone with Nipah virus mainly focuses on supportive care. This means doctors manage the symptoms and complications as they arise, like providing fluids, helping with breathing, and trying to control seizures. The lack of a specific treatment is why preventing transmission in the first place is so incredibly critical. Now, let's talk about the symptoms you must know. In the beginning, Nipah can be deceptive. The early symptoms can look harmless, almost like a common flu. This can include a fever, a bad headache, muscle pain throughout your body, a sore throat, and a cough. Because these symptoms are so general, it can be easy to dismiss them as something minor. However, in severe cases, the virus can become much more aggressive and attack the brain. This is when the illness can progress to a very dangerous stage, causing symptoms like confusion, drowsiness, and disorientation. It can also lead to seizures and severe brain swelling, a condition known as encephalitis. In the most critical cases, patients can fall into a coma. What is particularly alarming is how quickly the symptoms can worsen, sometimes within just 24 to 48 hours from the onset of serious illness. This rapid progression is another reason why early detection is so vital. So, with all this information, here's the most important fact for everyone watching in America. As of right now, there are no confirmed Nipah virus cases in the United States. Let me repeat that. Nipah is not currently in the USA. Health authorities like the CDC are actively monitoring global outbreaks and have systems in place to detect and respond to potential threats. While isolated cases and small outbreaks have occurred in other countries over the years, Nipah is not actively spreading in the United States. Because of this, experts agree that the risk to the general American public is currently very low. But being aware of global health issues still matters, because early detection saves lives, especially in an interconnected world. So what should you actually do? The key is not to panic, but to be prepared with good information. The guidance is straightforward. First, if you're traveling to regions where Nipah is known to occur, avoid contact with sick animals, especially pigs and bats. Second, practice good hand hygiene, like washing your hands frequently with soap and water. This is a simple but powerful habit that protects against many viruses. Third, Avoid consuming raw or potentially contaminated fruit products, like raw date palm sap, which has been linked to outbreaks in other countries because bats can contaminate it. Most importantly, follow public health updates from trusted sources like the CDC and the World Health Organization. If you have traveled internationally to an area with a known outbreak and you start to feel sick, with symptoms like fever or headache, seek medical help immediately and be sure to tell your doctor about your recent travel history. Panic is not protection, information is. Right now, Nipah virus is not a direct threat in the USA, but staying informed is always the smart thing to do. Viruses don't spread because people know too much. They spread because people know too little. Understanding the facts helps us stay calm and prepared, not fearful. If you found this information clear and helpful, please share this video to spread awareness, not fear, and subscribe for more clear, honest health updates. Your health deserves facts, not rumors. Thanks for watching.